Topic for today is understanding high blood pressure. And before we start, we want to thank our sponsors, Accent Style Boutique for the use of the space, Publix Supermarket for refreshments, Automated System Consulting for audiovisual support, and MARB Language Services for providing interpretation in Haitian Creole and Spanish. Now, for those of you who are not familiar with the Orijin Foundation, our mission is it aims to increase the level of education and participation of BIPOC communities in positive behaviors to fight the different layers of disparities affecting these communities. Our core values are authenticity, which is being true to ourselves in our originality. Preservation, to give honor to knowledge that has been transmitted through generations, and conserving the important aspects that define cultures. Respect, we keep in high regards each other's contributions to our joint journeys, recognizing individuals' importance and value. Integrity, honestly mirrored through a moral compass that upholds our actions. And sharing, which is to occupy a collective space of love to promote exchange and growth. So Orijin Foundations was, what's the word? Started in 2021, thank you, by Natacha Zamor. Natacha is a native of Canada with roots tracing back to Haiti, and she has dedicated her life to community service. From her early years, she accompanied her father to the Haitian Community Center in North Montreal, actively participating in activities that instilled in her a profound sense of service and community involvement. In her teens, she became a youth leader at the Centre Communautaire des Haïtiens de Laval, unveiling a facet of her personality that would continue to shape her path in the years ahead. Following her mother's path, she earned a bachelor's degree in nursing in 1998, and in 2000, she moved to the United States. For over 25 years, she's made a substantial impact in nursing, excelling in areas beyond bedside care, including advocacy, quality control, legal matters, community health, and ethics. Natacha wears many hats, holding certifications as a personal trainer, community organizer, and language justice activist. She is also a dedicated dancer and teacher, promoting cultural preservation and diversity. Throughout her various roles, her unwavering commitment to service and catalyzing positive change in people's life remains constant. So like I said earlier, she founded the Orijin Foundation, and she's our speaker for tonight. So without any further ado, let's welcome Natacha.
Thank you for the introduction. And I just want to make sure that everybody understands what it is that we are going to talk about today. It is a topic that is of the utmost importance. It is actually one of the conditions that pushed us to start Orijin Foundation. Between cardiovascular disease and diabetes during the pandemic, that turned out to be factors that made people in our communities drop like flies. it unveiled layers of disparities. So when you think there's only one type of disparities, the determinants that cause those factors are layers. It's like a monster with multiple heads. So that's why at Orijin, we try to combat as much as possible different disparities, but health disparities is always at the heart of everything. So today we're going to talk about hypertension and understanding high blood pressure. If at any point anybody has questions, just stop and ask me the questions, but we always reserve some time at the end also to ask questions. And if you are on the Zoom and something pops up, please don't hesitate, put your question in the chat. And at the end, Luana will then, read the question so that we can have a nice conversation. So let's begin. Understanding what is high blood pressure. High blood pressure is a medical condition that is characterized by the elevation and abnormal force of the blood on your arteries. So a lot of time people think high blood pressure is the heart beating too much or working too hard. It's not that. It is when the heart pumps, the pressure that it puts on your arteries is too much. And when that pressure is too much, what it can cause is either ballooning, what we call an aneurysm, or rupture. And you end up with a CVA, cardiovascular accident, excuse me. So when you look at your blood pressure monitor, you have the numbers. And usually when I talk to either my patients or family members or anybody in general, they tell me, oh, the top number, the middle number, the bottom number. But on the machine itself, it's 1, 2, 3. The top number is called the systolic pressure. The middle number, which technically would be the number underneath, is the diastolic. And then the last number on that monitor is usually your heart rate. So that's something different. Your systole is the pressure on your arteries when the heart pumps. So when the heart pumps and it pushes that blood through your arteries, it's the pressure in which it's being pushed. The diastole or diastolic blood pressure is when the heart relaxes, you still have pressure in your arteries. And it's the pressure that is in your arteries. So, of course, I always have to bring visual stuff. That's the teacher in me. I don't know if you guys can see on this monitor. Maybe I should get a little closer. But when your arteries are clear, that's okay. When your arteries are clear, this is what it looks like. It's supposed to be just clear. And the muscles are supposed to be supple. There's muscles also in your arteries. The vein, no muscle, but the arteries, there are muscles so that it can help to push the blood to move. When you have high cholesterol, you have plaque inside your arteries, they tell you have fat deposit. It begins like this, and then it progresses sometimes to clog the artery completely. So just imagine your artery like a garden hose. When the garden hose is clear, the water flows through it easily. When the garden hose, you start to constrict it, what happened? Then the water, it pushes, there's pressure on it. It's the same thing with your arteries. So when it starts to be constricted because of fat deposit, it gets smaller and there's more pressure into it. I can't see. Yes. Now, what are the numbers for high blood pressure? Anybody knows what the normal value is supposed to be? No. Okay. Back in my days, when I was in school in the 1990s, a normal high blood pressure was 140/80. Now it's 120, but anything below 80. So of course, more people are on blood pressure medication because of that, but that's another subject. So 120/80 is considered normal blood pressure. Between 120 and 129/80 it's considered elevated blood pressure. Anything that is over 130 and between 139 and over 80, you're considered stage 1. And when you go over 140 and over 90, then you're full-blown stage 2 hypertension. That means you have it bad, okay? But like I said, about 20-something years ago, 140 over 80 was the norm. So if somebody comes up to me and their norm is 135 over 70 or 135 over 81, I don't panic over this. If your normal is 110 over 60 and all of a sudden you have 130 over 80, then I'll know there's a problem. But it's relative. But those are the numbers that now have been given by the CDC, by the World Health Organization, the American Heart Association. So when you go see your doctor, if they take your blood pressure and it's anywhere over 120, over 80, they're going to tell you that you are either pre-hypertensive or if you have full-blown hypertension, depending on your value. And of course, when you go see your doctor, there's something called the white coat syndrome, which is your blood pressure might be normal, but just the fact that you get to the doctor's office, you know you're going to go there, your anxiety start going up. So it just so happened that every time you're at the doctor's office, that's when your blood pressure is high. So what I recommend to do, I do this with my husband, I do this with my patients, anybody I say, if you're suspecting you have high blood pressure, or if your doctor at one point said, oh, your blood pressure is kind of high, start monitoring your blood pressure on a daily, log it, keep a log of it. So that way, the next time you go to your doctor's office, if you wake up every day and your blood pressure is 120, 122 over 75, and then all of a sudden when you go to the doctor it's 140 over 80, obviously it's because you get nervous or anxious when you get there and it goes up. So then you have something to show the doctor that, look, no, I don't have high blood pressure because this is what my numbers are usually, and I've been taking my blood pressure for how long? And then they'll start considering, oh, maybe you're just nervous because you're here. But initially, they're not going to consider this. They're just going to tell you, oh, you're pre-hypertensive. And if the number's really high, oh, we're going to put you on medication. So something to keep in mind. Who is more at risk for high blood pressure? Of course, if you're overweight, yes, you're going to be more at risk. Because being overweight, that means that you have more fat deposit. And where does the fat deposit like to go? Into your arteries. And obviously, it's going to squeeze in and then create your blood pressure to go up. If you lack physical activity, the more you exercise, the more you build endurance, because your heart is a muscle and those arteries have muscles also in them. So when you exercise and your heart gets used to a certain level of activity and your arteries are used to getting larger and smaller and contracting and restricting the way they're supposed to, it helps. If you don't do any activity, well, you're not going to have any endurance. Your heart muscle is not going to be conditioned, and your arteries muscles also are not going to be conditioned. So when you put everything together, it culminates. Unhealthy diet. Everybody knows the no salt diet for high blood pressure. That's the first thing that the doctor is going to tell you. I just say unhealthy, period, because it's not just salt that can mess up your blood pressure. Sugar, having too much sugar in your diet. Of course, it might lead to diabetes, but also the sugar will convert into fat. And where does the fat go? Into your arteries. And of course, high cholesterol. If you eat fried food, if you eat food that has a high content of fat, it's going to go deposit in your arteries. Too much alcohol. Sometimes people think that, oh, alcohol is a blood thinner, so we're good. No, alcohol has a high sugar content, so you're not good. It's going to do the same thing that eating sugar does. It's going to switch into fat and then go deposit into your artery. Tobacco use. Smoking, that's the one thing that I say, just stop smoking. Alcohol, I say decrease it, but smoking, stop it. Because smoking is not about the fat content, but it's because of the nicotine and all the byproduct into the cigarette. What it does, it hardens your arteries. Where they're supposed to be supple and move when your heart pumps, what smoking does, it has tar deposit inside your artery, and it makes your arteries hard. So that means that there's no flexibility when your heart is pumping, so it pushes your blood with too much pressure. And of course, stress. I mean, we live in a society where stress is almost become the norm, and we have to change that habit, change that way of thinking, because when you're stressed, stress itself is not going to give you high blood pressure, but stress is going to make it worse. And if you are under stress consistently, well, guess what? Your heart, your hormones that create a stressful reaction is going to keep on putting stress on your heart and then on your arteries. Everything good so far? No question. And then there's the last factor. I kept it for last because I have a ton to say about it. I'm going to try to restrain. It is genetics versus environment. Now, everybody here, Black people are more predisposed to be hypertensive. If you're Black, then you are genetically predisposed. You have it's in your DNA, you know. So this narrative conditions people to think that if inevitably I'm going to have high blood pressure. Oh, my parents have high blood pressure, then I'm going to have high blood pressure. How about your parents have high blood pressure probably because of lack of exercise, because of the diet? And what did your parents do? They fed you the same thing that they were fed. If they were not active all their life, you know, they're probably going to put you in some sport just so that you look good. You know, my kid is doing this, my kid is doing that, but it's not going to be a lifestyle. It's not going to be something that they're going to do on a regular. And also, the environment has a lot to do with the factors, all those determinants. When you put people in an environment where they are food deserts, you do not have access to good quality food. You only have access to processed food. What are you eating? Food that is high in salt, food that is high in fat, and that is not just the parents, it's also the kids. It's intergenerational, it's everyone in that population. So I have really, really hard reservation about that DNA thing and saying that it's genetic, because I won't say the example that I was talking about before. In the 1980s in Africa, the #1 killer was HIV/AIDS. In the early 2000s, then it began to be cardiovascular disease. Now, why is that? It's because the West started to implement themselves more in that continent. You start having companies like McDonald's, Burger King, Kentucky Fried Chicken, starting to sell their product. The population in Africa started looking at the West as the American dream, as something to aspire to. So they picked up their habits, their way of life, and picking up their way of life, guess what they picked up too? Their diseases, their conditions. So now in Africa, #1 killer, cardiovascular disease. So don't tell me that it's genetic, because a few years ago, that was not the #1 killer. If it was genetic, it would have been the #1 killer from the get-go. So something's wrong with that narrative. So I want people to think more about the factors, the condition, how you were raised, and what it is that can be changed, because all of those factors can be changed. Your diet, you can change it. Physical activity, you can change it. Alcohol consumption, you can change it. Salt, you can change it. Smoking, you can change it. So all of these factors can be changed. So that means that this is something that if we all put our mind to it, we could literally reverse the steam. And why is it called the silent killer? Y'all are so silent. Oh, look at that silent killer. I killed it silent. It's called the silent killer because 46% of people don't even know they have hypertension because there's no symptoms. When you start having symptoms of high blood pressure, usually the damage is already done. That's when you start having headaches. That's when you start having blurred vision, dizziness, and you're wondering like, how come? Or you're very anxious, and because you're anxious, you're like, oh, let me take my blood pressure, let me check my blood pressure, and then you realize it's high. But you could have been having high blood pressure, or your blood pressure has been elevated for years and you don't know it. And that affects your eyesight, because, okay, I'm going to get a little bit in anatomy. You have the arteries, those are the bigger ones. The arteries will go smaller, smaller, smaller. And when they get to be really small, it's like capillaries, they connect with the veins, and they're tiny, like hair-like, microscopic. You have those small little vessels in the back of your eyes, and you have them also in your kidneys. And those small vessels are very sensitive to pressure. So that means that when your pressure is elevated, the first vessels that you're going to start seeing busting are the ones in your eyes and the ones in your kidneys. That's why when I look at somebody and I see like a blood patch in their eyes and their sclera, the first thing I think, like, how's your blood pressure? The first thing that comes to my mind is, how's your blood pressure? Because usually you have veins that pop in your eyes, either because you made an effort and it popped, that's how sensitive the pressure is to it, or your blood pressure is high and you don't know it, but you have veins popping in your eyes. And then you think like, oh, what did I do? Or you don't think nothing of it. It's your blood pressure that's up. And same thing with your kidneys. Yeah. Same things with your kidneys, and the kidneys, you can't see them. That's the worst part. At least the eyes, you can see it, but the kidneys, you don't see it. So when they start popping in your kidneys, then your kidneys don't function the way they're supposed to. And then it's a vicious cycle, because the kidneys are the one that filter your blood. So that's why it's called the silent killer, because by the time you get all those symptoms, the damage is already done. And if your blood pressure gets to a level that is really too high, and your arteries are rigid, or it balloons somewhere, so there's a weakness somewhere in the wall, it might burst. And that's when you end up with a stroke, a massive heart attack, cardiovascular accident. It kills you, basically. Any questions? You're good?
It's scary.
It's scary. It is scary. And I think that it's either people get to understand how this can affect their life and they don't need to be scared about it, they're proactive, or you need to be scared about it so that you do something about it. Because not doing anything is not an option. It is going to catch up to you no matter what. It's not like you can dream it away or think that I'll pray it away. It's going to go. It's not going to go away, and it's going to get worse. And I used to tell my patients, I still tell them the same thing. And I'm the type of nurse sometimes that's a little too blunt, but I'd rather be blunt with you than afterward you tell me, well, the nurse didn't tell me. I'll tell you, your blood pressure is high. If you have a stroke, you better pray to God you die. Because if you don't know what that stroke is going to do to you. You may come out with just a little weakness somewhere, and then you do some rehab or physical therapy and you're good, but you don't know. You may have a stroke, and next thing you know, you're a 30-year-old who has right side or left side paralysis. You're pissing on yourself, you need a diaper, and you are totally handicapped because of a stroke. And that could have been something that could have been prevented. So I will tell my patients bluntly what the consequences are of ignoring a certain condition. Like diabetes, I'll tell them, oh, your limbs are going to go one after the other. They'll start by chopping your fingers, your toes, and next thing you'll know, it'll be your leg. They look at me funny. I'm like, yeah, that's what happened, because then it's going to affect your circulation. And this is the end result of it. At the end, you suffer. And a lot of people will say, I'm not afraid to die. Well, but what you're afraid of is suffering before dying. And cardiovascular disease will definitely make you suffer before you die. So take care of it. So how can you control it and manage it on an upside? I'm scaring everybody right now. So on the upside, I talked about the multiple things. So first of all, I think it's important for everybody to have a support system. have either organization, and this is where the MIND program is going to come into play. Organization, you have the American Heart Association, you have the World Organization, your physician, or I would say healthcare provider, because there's nurse practitioners also that are primary care providers. Have a support system, people who are there to help you go through it. Because it's easy to tell people, you have to eat less salt, you have to exercise, you have to do this, you have to do that. But the reality of it, with the lifestyle that we have in this society, makes it very daunting. It's very difficult to do. So if you're not somebody who's already in that mindset, or who's blessed with a fast metabolism and who's active, then it feels like day one, I'll do it. And then after that, day 2, 3, 4, 5, I don't have the energy. So sometimes when you don't have the energy, you need somebody else to remind you that we need that energy, or who does it with you to get you going. So definitely get yourself a good support system. Eat healthy. So I never tell anybody to stop eating sweets, fats, whatever. It's not like cut all of this out of your diet. Because what's the first thing that happens when they tell you have to be on a diet? You crave everything you're not supposed to have. It's very restrictive. And this is supposed to be for the rest of my life? No, but little by little, start removing it from your diet, but give yourself some wiggle room where one day you do, splurge a little bit. But when you know, okay, and you know what, I'm going to eat some fried plantains today, and I'm going to eat some gruyere today. You know that tomorrow I'm going to walk probably a little bit more on the treadmill, or I'm going to bike or something to try to burn it a little bit more. Don't do that every day, because or else it's like a yo-yo. But once in a while, give yourself a little breathing room. Don't totally cut them, because or else it'll be daunting and it'll be just discouraging. Drinking, reduce. 1 glass of wine here and there won't hurt you, but if every 2 or 3 days you have to drink until you pass out, then definitely it's too much. Find a way to manage your anxiety, your stress, and it's not just a bubble bath with a little glass of wine, but literally being able to disconnect sometimes, being able to identify your triggers, whatever it is that is a contributing factors for your stress, you have to be able to cut that out. Because if this keeps on coming back, your stress keeps on coming back, and guess what? Your blood pressure keeps on being elevated. So I will never tell somebody to quit their job, but if the job is the stressor, then that job's got to go, because that job might just kill you. There's plenty of other jobs to go around. You'll find something else that may not give you that same level of stress. If it is, I don't know, your car, it keeps on breaking parts, it might be time to replace the car, or it might be time to take public transportation. Like one way or another, there's always options. Medication is something that we need to talk about also. You need to take your medication if it's been prescribed. I'm one that would prefer preventing so that you don't get to be on medication, because I have a bone to pick also with medication in the pharmaceutical company. When you start being on medication, just consider that there's no reason for them to want you off of it. So you're going to be on it. So you have to figure out a way not to get on it. And if you do have to take it, because at one point you have a crisis and it's really high, your goal should be, this is temporary. I take this because I need to bring it down and manage it now. What can I do to maintain it here so that I don't have to take that medication? That should be the goal. Doesn't mean that it's always going to happen, but that should be the goal. Now, let me talk about the different types of medication. All right. Now, you're going to hear, if you have high blood pressure, usually your doctor doesn't really tell you, I'm going to prescribe to you an ACE inhibitor. They just tell you blood pressure medication. But there's different ways that the blood pressure medication will affect you. You have the diuretics. Diuretics, those are the ones that they say the water pill, the one that makes you pee, the one that a lot of time people don't want to take, because they take it and they're in the bathroom all the time peeing, and they're like, you know what, this is for the birds, and they don't want to take it, but it's important. to take it, because if they put you on diuretic, it's because you have too much fluid, you're retaining fluid. So if you don't want the pill, really take a hard look at your diet, because most likely if you're retaining fluid, it's because you have a high content of salt in your diet. Your body cells are trying to dilute that salt, so they're retaining everything. So cut the salt, most likely it'll go down, and then you may not need to be on the diuretic. Then you have the beta blockers. The beta blockers are going to slow down your heart rate, and with that, help to decrease the blood pressure. You have the ACE inhibitors. Those are the ones that prevents your body from making a hormone. So these ones play directly with your hormones, and your hormones are your conductors for your body. If your body is the orchestra, your hormones are the conductors. So now you're getting a pill that is playing with your hormones to stop a hormone from secreting in order to reduce the contractibility of your heart so that the blood pressure is not as high. Then you have angiotensin receptors. This one prevents the hormone from doing what it's supposed to do. The ACE inhibitor stops it. The angiotensin prevents it. The calcium channel blocker, it lowers the contractibility of the heart. So basic contractibility means the heart, how strongly it contracts. So it lowers that. So if your heart is supposed to go, it's going to make it go a little bit less. Sometimes what happens with that is that the heart does not empty itself the way it's supposed to also. You have the alpha blocker. This stops the nerve signal in your heart, that electrical current that tells your heart, contract, contract, contract. Well, that one, the alpha blocker, it plays with that electrical circuit so that it doesn't contract the way it's supposed to. The alpha-2 receptor agonist, they stop your brain from sending the signal. So the alpha blocker stops the signal, the other one stops your brain from sending that signal. So, and then sometimes the providers will give you a combination of medications. So you'll have one medication with another one, so a diuretic with a beta blocker, because they want to tackle a different part of your hypertension. They don't know what is causing it, so they're just trying stuff. So this is not to this is what pharmaceutical does. They are necessary, especially if you're at an acute stage. So when the blood pressure is not under control, it cannot be controlled by exercise, diet yet, then they have to give you medication. I tell people, always ask your doctor what it is. A lot of times doctors or nurse practitioners will tell you, I'm going to prescribe this for you. And you're like, okay. And I think it's because when you're in that, you don't know what to ask as far as questions. So you just take whatever they give you. Rule of thumb, before you even go to the doctor's office, you know why you're going to go there. Prepare your questions in advance. Write your questions, because I can guarantee you that when you get to that doctor's office, they'll give you their spiel in their medical lingo. And then when they're done talking, they're like, do you have any questions? And you'll be like, you'll draw a blank. And then they'll give you the prescription and you just go fill it out and you don't know what you're taking. Know what you're taking. That way you can ask questions. That way, you can be proactive about it. That way you can say, is there an alternative to this? If you don't, I don't want anything playing with my hormones. Can you give me something else? Is there something else? Can we do more tests? Can you give me maybe 3 months to see if I can lose some weight? Because automatically you lose weight, your cholesterol usually goes down, and then the fat, the cholesterol inside your arteries, that reduces also. Your blood pressure might start going down. So you have to discuss this with your physician, because some of them will go preventative measures. Most of them will go with the medication prescription. And I mean, I gave you a little idea of how those medications work. I don't know. I don't want to have something blocking my electrical circuit to my heart. I don't want to have the diuretic in. Okay, it makes me pee. But the downside, when you're peeing, if they give you too much of it, then you pass on too much of your electrolytes also. And then it creates a whole other issue with your electrolytes. So always make yourself comfortable to write your questions in advance so that you can ask your physician or your nurse practitioner about your care, especially when it comes to matters of the heart. Any questions? It's an eye opener. It's an eye opener. Good. So this is where Move Your Numbers Down, or the MIND program, is gonna be coming in. Yes, this presentation also introduced the MIND program. Orijin Foundation has three pillars. There's the Orijin Project. There is On Pali that we're doing right now, Let's Talk, where we have every last Friday of the month webinars, workshop on different health issue or issues that affects the BIPOC population, Black and Indigenous people of color. Most of the ones that we've been doing so far is oriented towards health, but if there's anything that's financial, anything that we see is needed in our community, that the food is about to die, then we'll address it. And then the MIND program, we're planning on launching it in January. It is a program where we literally are going to have different healthcare providers and wellness providers. So it's not just physician and nurses. It's going to be clinical herbalists. It's going to be doctors in osteopathy. It's going to be personal trainers. It's going to be nutritionists. So we are building a network with different healthcare professionals to be of support. We're not going to replace your healthcare provider. We're not a doctor's office, but we're going to be of support. So when you're being told your blood pressure is high, you need to exercise, you need to change your diet, you need to do this, you need to do that, they write a prescription, oh, here you go. And then you're there and you're like, okay, what do I do? Okay, they tell me I need to exercise. Let me go and sign up for LA Fitness. You go to LA Fitness, it costs you an arm and a leg. You don't know what exercise to do. You don't know what to target. You don't know, how long you're supposed to walk, run, elliptical, what. It becomes very overwhelming. Oh, go on a diet. Not all diets are good. You need to have a nutrition plan or a nutritional intake that is adapted to your lifestyle. But doing diets that are too restrictive are going to mess you up, and you may lose the weight really quick. And you're like, oh, it worked. Yeah, and then you eat just a little bit of sugar, or you're not able to sustain it, and next thing you know, you triple the weight that you lost. So having somebody to accompany you to help you slowly decrease what it is that you need to decrease. And being that I'm Haitian also, and I know a lot of people from African or Caribbean descent, what you're talking about, I can't have plantain. What you're talking about, I can't have rice. They have all those diets, but the diets are not really adapted to our nutritional needs. So when you tell somebody who's Haitian, Jamaican, African, cook the white rice, but you don't give them any alternative, forget it, they're not going to be compliant. So the nutritionist that we want to bring on board is going to be able to help you figure out alternatives to what it is that you're supposed to be eating or doing. And have a community that is there to accompany you also, because it's not going to happen the first day. It's like when you stop smoking. You can't just stop cold turkey. Some people do, kudos to them, but a lot of people will fall back. Whenever there's a stressing factor, they'll go back to that cigarette. It's difficult, it's addictive. Food is the same thing, and any lifestyle, usually negative lifestyle are addictive as well. So this is where the MIND program is going to come into play, to be there as a support, as a group of network, so that we can help people, accompany them in the phase of trying to prevent those chronic diseases and trying to make it so that you can get on track and that there's people there to support you. Wow. That's it. Yeah. I'd say, okay, I finished up by saying self-care begins with information and education for yourself. So self-care is not just about taking that trip, about taking that bubble bath. Self-care is everything that you do to make your life better for yourself. And the first thing that you need to do is get information so that you can educate yourself. Because if you have information, you don't know what to do with it, it's worthless. So you need to get that information in order to educate yourself afterward. So whichever way you can get it, through community organization, support group, healthcare providers, freaking internet. But you gotta be careful with the internet though, because you get all sorts of stuff on the internet and sometimes it does not apply to you and it might make you freak out even more. So always verify with a healthcare professional. That's it. Thank you. Any questions? Yeah.
So, you talk about blood pressure, but you just can have the low blood pressure.
Low blood pressure can be a problem too.
From what I can understand, so low blood pressure have more impact on the heart, right?
The heart has to pump more in order to get the blood to flow. So that's why it has more effect on the heart. It's because your heart gets tired, it has to pump faster. So a lot of times you see people who has low blood pressure, their heart rate is going to be way up. And when the heart pumps faster than it's supposed to, at one point, don't forget, the heart is a muscle. At one point, that muscle gets tired. You know, when you get cramps, your muscle goes into tetany, it frees up. The heart muscle, the same thing may happen. So that's why low blood pressure also is not, and it depends how low. Like for the longest, my blood pressure was 90/40. And they used to freak out because they were like, you're black, you're supposed to be higher. But that was my blood pressure, and that was my healthy blood pressure. If it would go 120/60, I would get a headache, you know? But that's because it's good for me. But somebody else, 90/40, their heart might just be about to stop because it's beating so fast to try to get that blood to flow.
Another question. Someone with high blood pressure, is it good for them to be running?
Yes. Start by walking first and then run. But any physical activity, running is just one of them. What it does, your heart is a muscle. So when you start increasing your physical activity, you start demanding more on the muscle. So that's why it has to be gradual, not one shot. One day you decide that you run a marathon. When your muscle starts to work more, you start demanding more, it starts conditioning. Just like weightlifting, just like doing your squat to have booty and thighs, your muscle also, when you do cardio, your muscles, you demand more. So it's conditioned for more. And then it doesn't need to pump as fast in order to get your blood circulating.
You can't work.
You walk.
But it's still affecting your knee.
Yeah.
So why would you think that?
Then you find something that's low impact. Swimming is the perfect one. Because you have swimming, you have those machines that are part electrical. There's no impact, you just go. What affects your knee is the impact when you walk or when you run. You can put support on your knees also. Bicycle is a good one also, but it all depends what's wrong with your knee. If it's your cartilage, is it your tendon, is it your meniscus? Like you have to figure out what's wrong with your knee first, because bicycle is good, but bicycle might make it wear out also because you have to bend your knee constantly when you're biking. Boxing, yes, that's good for cardio. That's super good for.
More about
Yes.
What's better?
What's better?
Blood pressure, you have a home machine or the one in the
Doctor's office?
Or are they all the same?
No, they're not all the same, because you have the ones that you put on your wrist. Those are the worst one, I believe, because it'll give you false readings. The one that you put on your upper arm that are automatic, they give you a range. Okay. I am a starch believer to this day. When I go see my patients, I use the old-fashioned one. my stethoscope, and I press and I listen. This will give me the true reading. This will give you whatever the sensor feels. So the sensor may be off by 20, but the rule of thumb is if it gives you 140/90, so you are somewhere between probably 120, 125 over maybe 150, like you have a range. So just consider that you're in between that. Get it? Yeah. So it's not, the best one is the stethoscope and the sphygmomanometer. That's the best one. Do on your wrist, on your upper arm, they're okay. But to me, it's a range. It's not the accurate one. At the doctor's office, they have more advanced blood pressure machine. So it'll be a little bit more accurate. But that is if they calibrate it, if they take care of it. I mean, it might be good, but if they don't calibrate it, if they don't change the battery, then it might give you a false reading. Yes. So if you go to your doctor and it gives you some weird reading, ask them, can you please do it the old-fashioned way? Hopefully the person who's there learned how to do it, because nowadays, yeah, but insist, can somebody do it the old-fashioned way to see if it's accurate? Because I bet you that it won't be the same number.
Yeah, the worse your number is at the doctor, the better it is for them. Question about the left, taking your blood pressure on your right arm versus your left arm. Does it really matter?
It doesn't really matter. It doesn't. You're always going to have one that the reading is a little bit more elevated than the other. If your blood pressure is high, your blood pressure is high. And yes.
Hi, c'est Emily.
Emily.
Yes, ça va?
Uh-huh.
So, je peux parler en français, c'est correct?
Ouais, ouais.
OK. Donc, je voulais juste dire peut-être quand on s'assoit chez le médecin, s'asseoir peut-être 5 minutes quand on nous le permet avant de prendre la pression, juste make sure que tu es reposé avant de contrôler. C'est pas j'ai monté l'escalier, je prends ma pression.
What she said was, if you go to the doctor, have them wait maybe 5 minutes before they take your blood pressure. Because if you just went up the stairs to get to that office and you sit and they take it right away, it's going to be high.
It's gonna be high.
Doctor will move you up.
Huh?
They'll move you to the side.
You gotta take these things and really think about how that's okay. This is my soapbox. This is a healthcare industry. It's an industry. So take it for what it is. You will have few providers that are really have integrity and really want your well-being. But even those that are the best ones, they are stuck with a system that tell them they need to see that many patients a day, they need to have that many sign up, or else they don't make it. They can't pay their staff. So at the end of the day, the bottom line is I need to make money, and you are just a number. So you have to really be proactive about your health and take charge of it. So when you go there, it's a service I'm going to have. Okay, you're going to give me my service. Be prepared. When you're going to go buy a car, you don't just walk in and go like, I need a car. You got a car for me? No. Usually you do your research, you know what type of car you want, you know what your credit score is, you know about what you can afford every month, and you go in ready to, discuss what is going to be the term. Do the same thing with your health. Be ready. Other questions? Was that clear?
Chat.
In the chat, anything in the chat?
To unmute or pose questions in the chat.
Uh-huh. Somebody's having a respiratory and cardiac. No, because the ambulance from the
Yeah, sometimes.
All right, everybody's good. Ooh.
Nobody really put any messages.
No questions? All right, well, the bottom line is most people don't know they have high blood pressure. So in this room, could say almost half.
There's a question.
There's a
What
question?
food can you eat with medication reduction?
What food can you eat? Oops.
To help with, reduce medication, what food can you eat?
Oh, well, that depends. It depends what medication you're on. It depends.
Magnesium intake.
Magnesium usually relaxes your muscles, so it could help, but you don't want to take magnesium and then go overboard with the magnesium also. Because a lot of time what people do, they take those supplements, they take like extra magnesium, extra this, extra that, and then they don't realize that they're overloading their body with it, and you're doing the opposite. Now you have a surcharge. When you have your electrolytes or vitamins or anything, this part of it, the body will just eliminate normally through your kidneys. Some others need fat to eliminate. And when they have too much in your body, they stay there until they get toxic. So you have to be careful about taking those supplements to try not to be on blood pressure medication. Diet, the rule of thumb, reduce fat, reduce sugar, reduce salt. That's the rule of thumb. Not saying eliminate it, but reduce it. And it's not just one thing that's going to help with it. So it's not just, oh, I'm going to go on a diet and then that's going to take care of it. You also have to increase your physical activity. It works in symbiosis in order to start seeing some changes.
So, Tosh, can you hear me?
I can hear you. I hear something.
This is Ralph.
Hey.
Reason why I asked the question is sometimes people want to take supplements, but what foods that are naturally grown that can be more natural, in other words, allowing the body to process it quicker than taking supplements? I believe that is what sometimes we do. We want to take supplements, but there are foods out there like kale, things like nature.
The food that you take, like I said, it depends on it's really each individual. I could tell somebody to drink more celery juice, to have more, the green juice that has the celery, the cucumbers and that, because that's a natural diuretic and it'll help you eliminate. But if your blood pressure, your problem is not because of diuretic, because you're retaining fluid and it's something else, then you're going to be doing this for nothing. Like you might be barking at the wrong tree. You may be eating a lot of greens and that helps to clean up your arteries. But if it's something else, if it's because your heart is not firing up properly and it's putting too much pressure on your arteries, then that type of diet may not work. So I think people have to figure out first if they're hypertensive and what type of hypertension they have. Is it because they're retaining fluid? Is it because, and then they can tackle the food part.
Excellent. And one more thing I have to say is a lot of times stress plays a lot of part in it. So until you can identify the stress, you're also hurting yourself as well.
Yep. I agree.
Thank you.
You're welcome.
My question was, in terms of something for any kind, not just for blood pressure. So, what would be the limit? Like, why would you recommend the most length of time to use something? Anyway, if I'm using anything for